We really understand that a lot of people are very worried and anxious, but if you're not currently having either any symptoms or very mild symptoms, we really discourage you from getting a test at this time. On the other hand, if you've got shortness of breath or a new cough or a fever, those are symptoms that would potentially warrant getting testing. And what we're asking is for patients that feel they'll need a test is to call our nursing service first, and they'll be able to walk you through what the criteria is. And if you meet the criteria, we can help schedule you for it at one of our sites throughout King County and beyond. Many people are asking us whether we're seeing patients that are testing positive for COVID within our clinics, and the answer to that is yes, we are. The numbers at this time are still relatively small. The hospitals, because they're seeing the sicker patients, obviously have a greater concentration of COVID cases, but we are seeing them in the community, and most people are having relatively mild illnesses and are able to just care for themselves at home. And so those are the patients that we're supporting through testing and also through our telehealth. We are really asking patients who feel they need to see a provider in one of our clinics to call ahead first, because we want to make sure we're minimizing their exposure to other patients who may have the illness. We're trying to deal with the majority of these patients through a telehealth visit. And so if you need to come in, if you've got a laceration, for example, or think you might have broken a bone, we can definitely accommodate your needs with an in-person visit, but we're really trying to keep those to a low number, and wherever possible, do these virtually. The younger you are, the less likely you are to have a severe illness if you do come down with COVID-19. That said, anybody can get the illness. So while everyone's heard that people over 60 might be at increased risk for severe illness, patients who are younger adults still are at risk for, one, getting the illness, and two, having a severe illness. It's not as high as an older patient, but it's significant. And so we're really reminding people that everyone needs to follow the advice we're being given by public health with social distancing, self-quarantining, those kind of measures, that it's not just something that older patients have to do. We really need to do everything we can right now to reduce the spread of this illness. And one of the phrases that I think many people are hearing about now is called, we are working to flatten the curve. And what that means is if we did nothing to try and reduce the spread, the spike in cases and severe illness would be potentially so substantial that it would overwhelm our healthcare facilities. That we wouldn't, as has happened in Italy, we wouldn't have enough beds, we wouldn't have enough ventilators. And so one of the hopes that we have is that by really working now to reduce that spread, that the number of people at any one time with severe illness will be lower, so that our healthcare capacity can keep up with that demand. And so, again, what we do now in terms of social distancing, quarantining, and other measures is probably the most important thing we can do now. As incredibly boring as staying home can become, especially if you've got small kids or live alone, it's very boring, but it is absolutely life-saving for everyone else and yourself.